And the first presenter will be Dr. Fuzhong Li. He is a native of Shanghai, is a senior research scientist at the Oregon Research Institute. He received a Master of Arts from University of Oregon, and his PhD specializing in sport and exercise psychology was from Oregon State University. Dr. Li is, his research areas include exercise training on balance, mobility, cognitive function, research to practice translational research, and physical activity, and many other areas. His research publications include papers that focus on evaluating the effectiveness of exercise interventions, including Tai Chi Chuan on a range of psychosocial and biomedical outcomes, and falls prevention in older adults, as well as studies that deal with social and built environment influences on physical activity and overweight, as well as obesity in aging populations. Without further ado, I would invite the first speaker, Dr. Fuzhong Li.
Good afternoon. Thank you, Albert, for that nice introduction. And again, my name is Fuzhong Li. I'm from Oregon. It's kind of surprised to see the raining weather in Boston. That's where I live. In Oregon, 9 months rain season. It seems filled to me it's nothing. But anyway, I hope you enjoyed this morning's session and continue to, as the theme of the session is, if I understand, is learn, connect, and inspire from all the knowledge and information, and hopefully can walk away from this wonderful conference. I want to start by thanking the committee, organizing committee, to invite me. It's a very high pressure to be here and to share what we have done in the area of Tai Chi Chuan. And I'm sure so many people are dedicated and for years and working this body-mind relationship and trying to benefit populations of different age. My focus for the talk today is, as slides and implies, looking at the impact of Tai Chi Chuan training and practice on falls. I'm just going through and highlight some of the problem of falls in the United States and certainly apply globally and as we age, and spend some time focusing primarily on the kind of work that we have done in terms of embrace benefit Tai Chi for people with, I experienced cognitive and physical cognitive decline, and then wrap up with some of the ongoing research narrow heading. So the problem falls in older adults is huge. It's, it has, huge public health implications. We know 1 in 4 older adults fall annually. We also know most folks fall, they don't talk to their doctors. And on top of that, we also know, as we age, you look at the chart, from 65 to 85 plus, the rate of falls increase has really put us on a high alert. And look at the magnitude of falls. As we talk, someone's falling, unfortunately. And so based on the data from CDC, Center for Disease Control and Prevention, every second an older adult falls. So when you look at the data back into 2018, when we had a population of, 52 million, 32 of those report falls. And of those fallers, and you can see, 36 million people who, 36 million people report falls. Of those, how many? 8 million people result injury. And how many get hospitalized? Hospital admission was about 3 million. 950,000 people eventually enter in the hospital, and the death toll, 32,000. I know from data from 2020, death toll went up to 32,000. So as we continue, as the population continue to age in the United States globally, look at the projection, and by 2030, we're going to have 73 million older adults who are 65 and plus. By then, we project, you know, um, 52 million people will be falling. And of those 52, at least 12 million people will result in injuries falls. So that's a huge problem, and we're facing the society, individual, family, we all face the same problem. But look at the cost. It's tremendous cost to individual, to family, to society, to what? Most important, to healthcare. So back in 2015, the healthcare costs treating falls, injuries falls, was 15 billion. And over the years, that number stays pretty constant. But with the population continue to age, and the projection by 2030, we're going to reach 100 million, 101 million to be exact. So, as we probably know from those numbers, our task is huge. Public health implications, prevention implications. So what should we do? We should do lots of things to get people moving and do something and take care of the aging population. So there's lots of things that we can do. And certainly I mentioned at the very beginning, fewer than half of the older adults, when they fall, they don't tell the doctor. They're afraid. They're in self-denial. So we need doctors, health providers in particular, really need to talk to the patients, educate them, do fall risk assessment so they can put them into proper interventions. And of course, we have cataract, we have different vision issues. Vision check is one of the preventive measures that we need to take. And eventually, we also need to do, home inspections to make sure the carpet, lights, everything's safe for people to walk around, navigate inside or outside their house. And more important, like we all do, we are moving guys. We don't have, I really don't want to say it. I'm a physical activity guys. I don't try to not take the elevator, try to, take stairs. So every opportunity, every moment, every chance you have, you should walk, you should move. So moving is critical. Over the past 2 decades, there are tons and tons of research demonstrate exercise is good. Exercise is robust in preventing falls. And especially why? Because it helps you strengthen your lower extremity strength. Even Tai Chi, we show, and research shows Tai Chi can increase the grip strength as well. So strength, balance, performance, mobility, all those things that are essential to the way we live. A definite benefit. So when it comes to exercise, the benefit of exercise and preventing falls, when you look at all the research, hundreds research, when you put all the results together, they're good, they're strong. When you look at the statistics, the numbers, at least overall 23% reduction in incidence of falls. Right? But there are particular exercises that may be more advantageous. For example, if you have an exercise program that has a strength component, has a balance component, has a functional component, that will even work better. So exercise is good. That's current evidence, and that's also the current guidelines when it comes to fall prevention. Okay, so now we're all Tai Chi people, Tai Chi Chuan people. Though I use Tai Chi Chuan quite a bit, I think Chuan makes people moving, makes people, doing physical activity. So in the literature of Tai Chi Chuan, we've shown, and probably lots of people in the audience are researchers as well, and we know Tai Chi Chuan helps to improve low extremity strength because of weight bearing. And of course, when you have a strong muscle, leg muscle, low extremity muscles, and make you, more steady, balance. So that means help seniors in particular when they perform ADL, active daily living, or instrumental activity daily living. And as a result, strong balance, strong muscle, better performance in daily activities, and of course, you would expect less falls. So that's what the literature demonstrates as for up to today, and reduce fear of falling, and reduce risk of falls, and reduce incidence of falls in terms of rate of falls. The next few slides, I'm going to just quickly run through kind of line of work that we have done the last 20 years developed a very therapeutic, tailored, balanced, focused Tai Chuan program. So I'm going to take a look at some of the approach that we take, the evidence that we have in terms balance strength, in terms of ability to reduce falls, and then talk about implementation, talk about the cost. We know the cost of treating injurious falls is tremendous, and see how Tai Chi, and as we all do, Tai Chuan can help to reduce the health cost. So here we go. The program, the approach we take is really integration. We know Tai Chuan is mind-driven. We know breathing and takes a great role in control the posture, control the movement. And we know the martial arts is very based, the posture control movement is very based on the rhythm of your breath, the intent, the focus. But what about how, when you sit, when you have that upright posture, what does it require to take that posture? You better pay attention. So it means you need to be focused. They involve brain, right? And involve physical. Do you have the muscle? Do you have the core to support your upright posture, right? And required cognition. How about senses? You sit on the big base. You have the big bun, sit on the big base of support. How do you feel that posture when you leaning forward, backward, and you try to look at slides on the right side, on the left side? So you sway all the time. How do you integrate those elements with the characteristics, that unique characteristics that Tai Chi has, or Tai Chuan has? So integration is the key. How can you produce and have an integrated program that can produce coordinated, synchronized, partially controlled movements, right? Eventually can translate those movements into what we do. When you, in a safe way, Albertson, whatever, I just saw a grocery store across the street. When you pick the apples or tomatoes in front of food stands, how do you pick the best one? Not the ones in the right front of you being picked 1,000 times. So you got to be able to move your center of gravity forward. How do you prevent falls? How do you maintain your balance when you go back to your hotel and taking a shower tonight? You're going to lean forward or backward. How do you maintain a good equilibrium? So integration, what means to us, eventually will translate into meaningful movements that can help seniors do their activities of daily living, can help them go across the street, get the mail, right? Can stop at a traffic line, stop immediately, be able to navigate in the in a busy airport. So those are the kind of benefits that we want our senior to experience. So to us, most important, the program is good, it has to be functional, tied to what I do daily, right? Has to be modifiable. What people who are in transition to frailty. So we need to help them to accommodate their physical needs, their cognitive needs, right? And from public health perspective, we want to make a program that's scalable. We can do anywhere, right? And it has to be sustainable. So it means long lasting. So that's the goal that we had set out at the very beginning of our program development. And now the three questions that we had to start is that going to be, if you have a migraine, if I give you an aspirin, it's going to stop pain. It's going to be effective. Second question, well, are people going to buy into your program? And when you go to a senior center, a meal size, are they going to be interested? They say, this is evidence-based. Okay, am I going to take it or not? Right? When you go to your doctor, nurses, PT, OTs, are they going to be interested? So that's adoption. How many people would be interested in adopting your program? And once adopted, how many people can you reach? Population of interest, right? And are you able to have the program sustain over time? How much does it cost to prevent falls using Tai Chi? So those are kind of line of questions that we had set out at the very beginning, and then we're trying to pursue. Okay, so when it comes to effectiveness, we were trying to compare Tai Chi to stretching exercise, stretching as a very basic proxy for any exercise. We all need stretching. So, and stretching is better than doing nothing. We know exercise is far more better than doing nothing. We don't need to demonstrate that anymore. We just need, like people do clinical trial, what is the usual care standard? Let's compare that. So what we've been comparing is comparing to people who are, if we put in a stretching on the hall here, people in stretch, raise your hands up, put your hands on the side, feel the stretch of the lung, right? And feel the stretch of your buttocks and get your posture upright. So this is the basic program that we're comparing with. So we've shown that Tai Chi Chuan can improve certainly in line with the general prediction and improve strength, low extremity strength in particular, and it can, of course, improve balance, and particularly balance-related senses. So we have vision, we have hearing, inner ear, vestibular, and we have what? Proprioceptive that support us. The ankle, lots of senses around your ankle joints, lots of senses around your knee joints, hips. So we want to strengthen those. We need to have our seniors be able to compensate when you walk in a dark street, when you walk in your basement, right? What happens if the road condition is slippery? How do you use a compensatory strategy to recover, to maintain your upright postures? Okay, so mobility, how I'm going to help you to reach, to get a glass of water, a cup, how do you turn around from doing one job to another, transition from one position to another, mobility. And when it comes to fall prevention, and we know fear of falling is a huge, significant, there's a substantial proportion of older adults that start with the fear of falling. Fear of falling has a serious consequences. When you fear fall, you don't want to do anything. Restrict your physical activities. So fear of falling comes first. So it'll be to reduce fear of falling, incidence of falls, and especially, that's where the cost comes, injurious falls. When we work with people with Parkinson's, we will also show that Tai Chi Chuan is also good, be able to reduce people who have postural instability issues, in this case, Parkinson's patient. Okay, so meal sites, healthcare providers. I got 1.5 minutes left. And how we going to work with those folks who provide services to the geriatric populations. So I'm going to run quick through. So we're able to show adoptions, reach, be able to maintain fidelity, and be able to maintain once the program was finished, in a senior service provider setting. Similarly, we were able to show we were able to work with healthcare providers, your family doctors, your PTOTs, your nurses on orthopedics. So they were willing to refer the program to us. And Tai Chi Chuan write prescriptions. A PTOT, they can't write prescriptions. They write a pattern recommendation to us. So that's what we show. How much it costs to falls? So when it comes to falls, we know some of them you may know, an injurious fall is going to cost you somewhere around $9,000. That's start with the ambulance, 1,000-ish, and then X-ray, and then after that, all the cares needed. If you stayed hospital, 30,000 times that. And then so the bottom line, I want to just draw your attention to a study done by CDC. Net worth, net benefit, $500 per participant. If you are business, you're into your return on your investment, $500 per dollar you're going to invest. So think about that. So I'm just going to go. I just want to draw your attention to the last line. Last week I was really informed on Tai Chi Chuan. I'm very proud in the Tai Chi Chuan as part of a Tai Chi Chuan community. Tai Chi Chuan has been listed by United States Department of Health and Human Services as one of the strong evidence-based program for helping our seniors. So anyway, we are moving toward online. We want to reach out more people. So we're doing virtual trials. It's called decentralized trial, where we're able to reach all seniors across the United States. So that's where we're heading. And we're also concerned about people, older folks. They're not only at risk of falls, but also cognitively experience, due task declines. How can we develop a program that targeting two deficits, physically weak, and same time, cognitive deteriorating? So that's where we're doing now, but we're moving toward online. So I'm going to finish my talk right here. Thank you.